Hi, Barbara Wally here, orthopedic and sports certified physical therapist, here to talk to you about pickleball injury prevention. This is video 3 in a 5-part series. Video 1 spoke about the intro to pickleball. Video 2 spoke about nutrition and diet and learning how to play. And video 3 today is going to talk about equipment, appropriate intensity and frequency, as well as strengthening your body in between play. So let's dive in. First topic, equipment. Pickleball is more than just the pickleball and the paddle. It's important to know that appropriate shoes are big, so making sure you choose the right shoe wear, especially a pair of court shoes that you use specifically for pickleball, can give you the stability that you're looking for. This is not a good time to wear a pair of Crocs or a pair of very soft Hokas. Those can actually throw you off balance and not give you the stability you need for the quick feet motions that are required out of pickleball. Also, eye protection can be important. If you've got visual issues or you've got one eye that is not very good, it's a good idea to wear a pair of safety goggles that they make for sport. You don't have to wear the ones that you use for construction, but to wear a pair of eyewear or just a pair of sunglasses, just something to keep your eyes safe. If you're having some lingering injuries already, some knee pain, some issues with ankle sprains or some elbow pain, it's a good idea to wear a brace. You can get many braces over the counter at your local grocery store, pharmacy, or even on Amazon. And compression sleeves can be helpful. So compression sleeves, I'm sure if you watch sports, you'll see somebody wearing a sleeve that actually goes, over an elbow or over a knee. Those are areas where somebody's having a lingering injury and they're trying to keep that area nice and warm and bring some blood flow in, which can help significantly with pain. If you've got an arthritic condition, as you know, arthritis likes heat, so wearing a compression sleeve or even just a soft sleeve, a cloth sleeve, can be extremely helpful. And next, let's talk about intensity and frequency. So the challenge with pickleball is it is a lot of fun. So it's very easy to get carried away and play too much. So you have to be very careful that you're not overdoing it. Now, if you're somebody who really has been playing a long time, you played tennis for a long time, and now you're into pickleball and you're in pretty good shape, then you're probably okay to play a little more frequently. But if you're new to the sport, you really need to have some limits. So first and foremost, I would say listen to your body. If you're having an ache or a pain, or you're, say, a couple matches into a game and you start to notice your back is bothering you, that's a really great time to stop or to take a break and reassess how you're feeling. And if you haven't played in a while, say you've had some things going on and you haven't played for about a month, it's not a good idea to return to the same intensity or frequency that you did before. So if you were playing 3 or 4 matches in a day, maybe start with 2 and build up from there. And make sure you are resting in between play. It's so easy if you're losing, or if you're winning, you want to just keep going and not take a break and hydrate and let your heart rate come back down. Making sure you're taking breaks in between play. And make sure you're counting your heart rate, counting your matches, and also counting your time. You can decide, today I'm going to play for 60 minutes, and then decide that the next time you play, maybe you can tolerate 70 minutes. But just making sure that you're not overdoing it and holding yourself accountable. And you should always, with any exercise regimen, make sure you are taking 1 day off in the week. And it doesn't have to be complete rest. It can be relative rest. Maybe that's a great day to stretch, a great day to go out and do some yard work, just something different that is not the actual sport that you've been playing day after day after day. And the last topic today that we'd like to talk about is strengthening. So strengthening is the best thing to do on an off pickleball day. So if you play 3 days a week, the other 3 days a week are great days to go to the gym and do some strengthening. It is not a good idea to do your strengthening on the same day as pickleball. If you make yourself very tired from your strengthening workout, routine, and then you go and play pickleball, you may set yourself up for an injury. So strengthening, especially to fatigue, is a great thing to do on your off days. Really important body parts to work on are the shoulder, especially the rotator cuff. So working those muscles in the back of the shoulder, those rotational muscles. Also working your forearm muscles and your calf and your hamstrings, because those are 2 big muscle groups that tend to be susceptible to strain. And remember, for the upper body, it's 2 pulls for every 1 push. So make sure you are balancing out every exercise that you're doing by doing 2 pulling type exercises for every 1 push that you do. We're very tight with posture in the front of our chest wall, and pickleball is a very forward sport with how you hit. There are some backhands, but we're all a little more comfortable with our forehand. and with serving, that you really need to focus on pulling. So 2 pulls for every 1 push. And stay off the internet with TikTok. TikTok is a great place to get hurt. I cannot tell you how many people I know, people I've treated, that did an exercise program they saw on TikTok and now they're having problems. But the next video series, so that rounds out for today. Our next video series is going to talk about stretching and warm up and strategies for stretching and warm up, including static and dynamic stretching as well. So I hope this was very informative and that you have a great day. Thank you so much.